Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you are new here or a regular viewer that has not yet subscribed, please make sure you do subscribe. This way, it's the best way to help support my content. I would really very much appreciate your subscription. If you, as a woman with transgender history, has not yet joined Circle of Trans Womanhood, link is below in description. What are you waiting for? It's such an amazing community. We just had our first live group Zoom meeting with me. It was amazing. What are you waiting for? It's a fantastic way to connect to other trans women. It is especially amazing for those of you who are older, and especially amazing for those of you whose egg just cracked at any point in transition. Even if you have not yet started socially presenting, we have people in there already who have not yet stepped into social transition because they're not ready yet, but yet they're already part of sisterhood. So link is below. Highly recommend. And of course, you'll be connected to me and I will be a big part of that. For today's video, I want to address something that I see happening for so many of you who are older. By older, I mean, again, age is just a number, ladies. But for all of you who are, I would say, age maybe, 40 and up, whose egg just recently cracked, meaning you just had realization or you had a knowing, but now you finally came full circle to realizing and solidifying for yourself that you are actually struggling with gender dysphoria. I see so many of you make this particular, what I call inner mistake, that is causing you so much stress, causing you so much frustration. Some of my clients even have contemplated opting out of going and continuing to go through gender transition because of this. And it is so frustrating, and understanding why this is happening to you can help all of you from making decisions that you may regret. And decisions such as, I'm just not going to do it, this is never going to happen to me. All of those inner critical things that you hear inside of your mind. And yes, this video is specifically for ladies, for trans women. So, what am I talking about? One of the things that is incredibly prevalent is when your egg cracks and you realize you are transgender, you realizing you're a woman with transgender history, starts to be this feeling that you're not doing enough in your transition. For a lot of you, initially when the egg cracks, there might be a period of fear, trepidation to step forward, because you're going to be looking at your life and you're going to be wondering, am I actually able to step forward? There might be even fear that you're holding on to, that you might lose whatever it is you perceive you're going to lose by stepping forward into your life. But almost everybody I work with who is older, and the reason why this is happening for women who are older is because the longer you've been living with either gender dysphoria or lack of awareness that you're transgender, the more this need, am I doing enough, is going to be predominating because of your age group. You're looking back and you wish you could have done things sooner. And you're also realizing, being older, that means you have so much time left. So for a lot of you, once you move past your fears and you start stepping into gender transition, whatever that is for you, remember, everybody's different. Whether it is you're socially starting to present, you're starting medical hormones, you're starting maybe therapy, you're starting coming out period, there comes a period where a lot of you feel like, I'm just not doing enough. I'm just not doing enough. And that feeling of not enoughness, the feeling of not doing enough. And then a lot of you tend to start trying to figure out what else you can add and cram into your transition space. Does that sound familiar? I'm sure for a lot of you it does. I had so many people, not only my clients, but people who take advantage of the free 15-minute phone consultation that I offer, where I talk to them and they express the exact same thing, where they say that am I doing enough, Dr. Z? I feel like I'm not doing enough. And the reason why this feeling of not doing enough is so prevalent is because when you get older, ladies, hormones take a while. For a lot of you, hormones may take longer time than somebody stepping into hormones when they're 20 years old and they have not had testosterone exposure spanning decades. And for that reason, it can feel frustrating that things take a while. It can be frustrating to socially find how to express yourself. If passing is a goal for you, it can be frustrating to work on those elements that are still socially, culturally considered to be paramount to passing. Voice, facial hair, gestures, body language, physical appearance, all of those things can be frustrating. Makeup even, I always say this. There's probably like 1%, I don't know, probably incredibly small percentage of cis women who born with innate idea of style and how to do makeup. The rest of us, we had to learn. What it means for all of you as you're transitioning at older age, you're stuck with those same obstacles is now you're stepping into womanhood that is new for you. There's nuances here. There's things here you're not supposed to know how to do. You're bound to mess up. You're bound to make mistakes. You are going to sometimes, looking back, you're going to say, oh my God, what was I thinking wearing that? That's all part of the journey. So those stumbles are the only way to figure out what works for you. But because you are older and you're learning all of this, and on top of learning all of this, you're also, a lot of you are comparing yourself to what you see on social media, on the internet, on Facebook, on Instagram, on TikTok. And what you're seeing are probably a lot of younger trans women, younger girls with transgender histories, who are almost never posting in between period of transition, almost always posting outcomes, also through a filter. Some of you said, Dr. Z, you're glowing, your skin looks so good. Yeah, I'm sitting in front of a high definition camera that just blurs everything. I guarantee you, I don't look exactly like the way that you see me right now on the screen. And those girls are doing the same thing. There's a lot of filter. I'm not saying they don't look like that, but there's a lot of, smoke and mirrors going on. And so when you are transitioning later in life after you are cracked, and you're waiting, and you're learning, and you're stumbling, and you are hoping that the hormones are going to kick in, and you're seeing no other women in your age group, or very few women in your age group, who are going through the same thing, but you're seeing either a lot of older women who already transitioned or a lot of younger girls who have transitioned. And it's all of this outcome, amazing results. And sometimes you don't even know, people may have gotten a lot of surgeries to help them, to enhance their appearance. You're comparing yourself to this, and as a result, you're feeling like you are not doing enough things. You feel like, I don't get it. I'm taking hormones. I am, again, this is going to be very personal and subjective depending on what your goals are. But chances are for a lot of women with transgender histories, for a lot of them, it's going to be hormones. And a lot of women do prefer electrolysis or laser hair removal and voice training or finding a way to feminize their appearance. And here's the thing, ladies. A lot of those things do take time. I always say, I think almost every woman with transgender history, when she comes into her realization, I bet every one of you, if you're familiar with this, I brought it up before, that movie scene from Miss Congeniality where Sandra Bullock is disheveled police officer. She's about to go undercover and they need to turn her into this stunning beauty. And she goes into this warehouse where they have beauticians and hairdressers and makeup professionals and people who wax and pluck your hair. And lo and behold, in a couple of hours, she comes out, this gorgeous diva. I think like this, would be wonderful, right? I think a lot of us wish things in life would happen like this. The reality is that life doesn't work like that. And I guarantee you it wasn't like this for people you see on social media either. Yes, for some of them who are younger, it may have been faster or easier. Yes, I'm not gonna lie, that is true. I think you already know this. But for a lot of you, it's going to take time. And that is okay. You have to be okay with it. The number of trans women I work with who feel like they're not doing enough and being then torn to shreds internally, that somehow they're not playing the game right, somehow they're not transitioning correctly, somehow they're not doing the right dosages of hormones, somehow they're not doing the right regimen, somehow something is missing, somehow their electrolysis sucks, somehow A, B, C, D, E is a very frustrating game to play. I see so many who feel like there's something they need to figure out or know that others are doing, almost like there's like a secret somewhere out there, and the minute you learn it, you'll be fine. There is no secret out there. It's just perception that things happening quicker and faster for some. In reality, they do not. If you act just correct, or if you find yourself right now in the midst of that feeling, I'm not doing enough, stop and ask yourself, what are my goals? Right now, what are my goals? Right now, not what are my goals 5 years from today, but right now. If your act just cracked, I would really highly advise you to have your goal of starting to recognize that awareness of who you are and starting to learn more about what that awareness is telling you. If on top of that, you are ready for transition and you want to transition, and depending on what your goals, start asking yourself, based on my goals, what are some basic elements I can start putting into place? If it is hormones, start taking hormones and acknowledge that it's going to take time for your body to adapt to feminine hormone. It's going to take your body some time to drop testosterone levels. And then it's going to take your body some time to start feminize external characteristics. Acknowledge that even if it's going to take time, you're already in a way better position than you were when you were living in denial, or when you were struggling with dysphoria and did not acknowledge to yourself what was going on. When you were living with all of that ongoing daily pain, acknowledge that you're already in a better position, because even though time is what you need, each single day is going to get better. And the more you do, the more you're going to capitalize and compound on things, the more things are going to build up. Any one of you who is going through gender transition or has gone through gender transition knows this. You know that there's an element in the transition when you look at everything you're doing and you just want to stop. When you feel like it's never going to happen, when you feel like you're not doing enough, when you feel like you're not doing things quick enough, and then suddenly there is that moment when things just start adding up. You're starting to see your hard work paying off. And as a result, you start feeling more joy, more happiness, more connection to yourself. And that becomes, ladies, priceless. And that's when chasing all of this becomes secondary, and just feeling the connection to your womanhood becomes primary. Again, so many of you are struggling with this. I am not doing enough. There is no such thing as enough. Each one of you, trust me, I am a clinical psychologist. I have worked in this field for 20 years. Even a trans woman that works with me, that has access to all of the money in the world and can have any surgery she can have today, if she's not mentally prepared, psychologically ready, if she's also not in a place where she can handle it, or where she's even emotionally in that space, no amount of money in the world is going to help her. Trust this. Equally, for somebody who may not have access to resources but has eagerness and readiness, for them things are going to look different. Some people have large families, some people have relationships, some people have so many other things going on. I've worked with people who even have big public lives, and coming out is just not the right thing for them. Everybody's different. So this idea that I'm not doing enough does not exist. You have to anchor yourself in your life and circumstances and ask yourself, what does this not enough means to you, given your life and your circumstances? But please stop driving yourself insane and chasing the contrast you're seeing out there from especially younger girls who are not addressing the midpoint of transition, or not vocally speaking how they're fortunate because they're younger. And as a result, they paint this reality that it happens like this. Acknowledge where you're at. Trust the process. Comment below, let me know if your egg has cracked and you felt this pressing, suffocating feeling, I am not doing enough. Probably resonates with a lot of you. Love hearing all of your comments. Comment below, and I will see you all next time. Goodbye.